March, which is celebrated as International Women's Day around the world, where we recognize women for their cultural, political and socio-economic contributions to society. And here's wishing all of you listeners a very, very happy Women's Day. Today's women are multifaceted. They not just actually take care of their careers and their personal aspirations, but also of their family. But in all of this juggling, they forget one of the most important things that can support this journey of theirs, and that is their health. Which is why this International Women's Day, Alkem Oncology is spreading awareness about 3 major cancers which are most prevalent in India: breast cancer, ovarian cancer and cervical cancer, through their educational initiative, She Beyond Pink 2.0. This would help women know what the screening options available to them or what symptoms would actually look like, so that they can pursue healthier lives dedicated to their passions. Which is why we have today on Radio City our doctor, our expert, who will spread awareness about the same from Alkem Oncology. Thank you, doctor, for taking out your precious time.
Doctor, what is ovarian cancer and what is the risk associated with it?
Ovarian cancer, as the name suggests, is cancer of the ovaries. So these are basically 2 glands which are on either side of the uterus of females. So whenever there is abnormal cell proliferation happening in the ovaries, that leads to ovarian cancer. So coming to risk factors, I would say important is female sex per se. And the second one is some of the genetic predispositions like BRCA positivity. These people who have BRCA gene overexpression are at increased risk for breast cancer. Some of the medicines, especially medicines taken under unsupervised exposure of medicines. And fourth, other reasons are obesity and high age. As we age, the chances of ovarian cancers are more. And fifth one, we do see ovarian cancers even in younger females, for which we don't have a proper reason.
Doctor, what are the signs and symptoms of ovarian cancer and how it can be prevented?
So coming to symptoms, patients have unexplained pain abdomen, fullness or abdominal distension, any abnormal vaginal bleeding or discharge, or any change in the bowel and bladder habits like unexplained constipation, sudden cessation of urine output. These are the most common symptoms of ovarian cancer. Then coming to the signs, when we examine, we could feel a mass in the abdomen, or else we could feel that the fluid is filled in the abdominal cavity. This is what we see when we see a suspected case of ovarian cancer. Then to confirm, we do certain investigations like scans, tumor marker blood tests like CA-125, and a needle test, which is called an FNAC or a biopsy. Or sometimes post-surgery, we come to know that surgery would have been done for some other reason, abdominal surgery, like removal of the uterus or ovaries. And that time we come to know that there is, superadded cancer in that. Coming to prevention, I think more than prevention, it's early detection. So any symptoms you feel is not improving, meet your doctor. They'll do some blood tests and scans, and it's easily diagnosable. Second thing, if there is a strong family history of breast or ovarian cancer, such people are more prone for it. So if you have some symptoms, as I've told, meet a doctor and have a healthy lifestyle, regular exercise, good eating habits, have a healthy mind. I think these are the most important ones.
Doctor, what is breast cancer and what are the risk factors associated with it?
What is cancer? So many of us don't know what is cancer. So cancer is any unwanted, uncontrolled, abnormal growth which can occur anywhere in the body. So it is not wanted and it is not normal and it is uncontrolled. It is out of control. The body cannot do anything. So that is called cancer. It can occur anywhere in the body. And it most importantly, it has the capacity to spread to other areas. It can spread to other areas of the body. So that is the malignancy which arises in the breast tissue.
Doctor, what are the signs and symptoms of breast cancer and how it can be prevented?
There are many risk factors which are known till date. They can be broadly classified into modifiable and not modifiable. So some risk factors cannot be changed. It's there inherently. The risk is there inherently. They are called non-modifiable risk factors. And some are modified, can be modified by the individual itself, so that the risk of breast cancer can be reduced to a lot of extent. So this not modifiable, non-modifiable risk factors is the most important risk factor is age. So nobody can prevent aging. Aging is a natural process. And as we all know, not only breast cancer, most of the cancers are a disease of elderly. So age more than 50 years itself is a risk factor for breast cancer. The other most important non-modifiable risk factor is genetics. So some of the patients may have inherent genes which can predispose them to have breast cancer. So that is one thing. Or some of them can have genetic mutations. Not only it might run in the families or might not run in the families. They can have de novo mutations which can be a risk factor for breast cancer. Other important risk factors are early menarche and late menopause. So attaining periods before the age of 12 years is called early menarche, and continuing the periods, that is attaining menopause after 55 years, is late menopause. This can lead to the hormone excess. So the breast tissue is exposed to a lot of hormones for a longer period in early menarche and late menopause, which can be a risk factor for breast cancer. Other important risk factors, some individuals have dense breast tissues, dense breasts. That itself is a risk factor. And any personal history or family history of breast cancer or ovarian cancer. So personal history being the patient might have breast cancer in the right breast, maybe even predisposed to have another breast cancer in the future in the left breast also. Or the patient has a previous history of ovarian cancer, it can also be a risk factor for breast cancer. Even some cancers, up to 10 to 20% of the cancers, breast cancers and ovarian cancers, they run in the families and are because of this BRCA mutation. This BRCA gene is the gene which can run in the families, and it can cause breast cancer. And any previous history of radiotherapy, radiation exposure to the chest wall for any other cancer or any other cause can itself be a non-modifiable risk factor for breast cancer. Coming to the modifiable risk factors, which are in the patient's hands and which can be modified by the individual, is physical inactivity. Being not active physically is an important risk factor, and obesity, especially after the age of menopause, is an important risk factor. And hormone use, any history of hormone replacement therapy or oral contraceptives usage for long duration can predispose to breast cancer, and alcohol intake or smoking history can also predispose to breast cancer.
Doctor, what is the cervical cancer and what is the risk factor associated with it?
If you look into cervical cancer, many of the cancers in the body are usually not preventable. But cervical cancer is the one that is preventable. That is why it is important. Cervix is basically, it is at the mouth of uterus, at the entrance of uterus. So this is what is cervix all about. So cervical cancer is special in that it is completely prevented. It happens due to an infection. Just like COVID infection, corona infection, how it is due to a virus, cervical cancer is due to a virus called human papilloma virus. So usually in cancer, we do not know the cause of cancer. We say there are multiple reasons. For example, obesity, smoking, and so on. But for cervical cancer, there is one-to-one cause. For COVID, we have virus as an infection. Similarly, for cervical cancer, we have HPV virus as a cause for cancer. Therefore, it is completely preventable provided we take proper steps for it. So risk factors, what we usually consider are basically hygiene. Hygiene is a very important risk factor. You must have good hygienic sexual practices. That is the way to go to prevent sexually sort of transmitted disease sort of. So if you have a hygienic sexual practices, having one sexual partner or using hygienic sexual practices like a barrier contraception, these are very important measures to prevent cervical cancer. Over and above this, just like a COVID, we have a vaccine even for cervical cancer. So before the onset or before you start active sexual life, if you can take a vaccine for cervical cancer, we can prevent the HPV infection and possibly cervical cancer also. So with this, I would say cervical cancer is a good cancer in that we know the cause for it, and by having proper modifications and proper hygienic practices, we can prevent it from happening, and very importantly, we have a vaccine for it.
Doctor, what are the signs and symptoms of cervical cancer and how it can be prevented?
Well, cervical cancer doesn't happen in a day. It gradually happens over a period of time. That is one good thing about this cancer. It gives a lot of time for us to understand and diagnose it stage by stage. For example, in a blood cancer, it just happens over a period of time and you cannot prevent it. And lung cancer, it doesn't give time for you. But cervical cancer gives you time. It starts with symptoms, mild symptoms. So we have something called CIN, which is the initial part of cervical cancer, then going on to invasive stage 1, stage 2, stage 3, and so on. So this cancer gives time for us to understand and get ourselves diagnosed. And we also have something called screening. Even before the symptoms are there, we can undergo something called pap smear. They will through a scopy, we can just take a small smear and see in the microscope and see whether you are in the risk of getting cervical cancer. Pap smear is the way of screening. So it gives time for you to get diagnosed. So the symptoms are in the initial stages, you may not have any symptoms. And later stages, there are some mild symptoms, especially bleeding, intermenstrual bleed. Between the two periods, if you are having a bit of bleed, or a bit of spotting, if you have, that is an alarming sign. And post-sexual intercourse, if you have a bleed, or a painful sexual intercourse, if you have a bleed, then these are alarming signs for cervical cancer. And this usually happens in an age group of around 50-60 years around, in an elderly lady, so who is usually attained menopause. So if you have a bleeding post-menopause, again, it is alarming for cervical cancer. In advanced stages, you start getting back pain, urinary difficulty, difficulty in passing stool, and so on. So take home message is, this gives time, can get screened, can get diagnosed early, and you should be known about the red flag symptoms of cervical cancer, like intermenstrual bleed or spotting, post-menopausal bleed, or post-coital or bleed after intercourse. So these are the important warning signs of cervical cancer.
Thank you so much, Doctor, for spreading that information, especially on the cancers most prevalent in India. I would like all the women listening in fact, everyone listening in on this International Women's Day, that if you experience any of these symptoms, please do not delay and consult your doctors and make sure that you live a healthier life so you can achieve all those dreams that you aspire for. She Beyond Pain 2.0, an initiative by Alkem Oncology.